In this video, we will look at the questions that are asked in the household investigation form. The questionnaire is designed to be admitted separately for each of the household members who currently reside with the pulmonary TB index patient. In this questionnaire, the first section is titled Field Staff Details. This section comprises of the staff details who are visiting the household. The following questions are present in this section. What is the date of household visit? State of the household, district of the household, name of the counselor visiting the household, TU of the household, address of the household, area pin code of the household, what is the mode of screening? There are 4 options for mode of screening. These are face-to-face at home, face-to-face at health facility, face-to-face at other place, telephonic. The next section is titled Household Member Details. This section B comprises of the index patient's household members' details to whom the tool is being administered. Here, in the first field, you have to enter the Nikshay ID. The length of the ID should be between 7 and 8 characters. The next field asks you to enter the household member's unique ID. Here, each member is assigned a unique alphabet. For example, if the family has 4 members excluding the index patient, then the first member can be given the alphabet A, followed by B to the second contact, and the other 2 members can give the alphabets C and D respectively. In the field for the first name of the household member, you have to enter the middle name too, if there is any. In the field for last name, enter LNU if the member does not have a last name. The next question in this field are: what is household member age? What is household member gender? What is the household contact number? What is the marital status of the household member? What is the relationship of the household member with the index patient? What is the occupation of the household member? The next question asks whether you have ever taken the TB preventive treatment before or are you currently taking TPT. If the response here is no, then the counselor should go to the next section, which is household member TB screening. If the response is yes, then you go to the next question in the same section. The next question is, when did you take the TPT medication? The 2 options here are currently and previously. The next question is, what type of regimen was given to the household member? The options here are 3HP, 3HR, 6H and other regime. If the regime is selected, that is 3HP, 3HR or 6H, then the counselor goes to the last section, which is exit survey. If other regime is selected, then the next question appears which asks to specify the regime. Once you have specified the regime, the counselor will shift to the last section, which is exit survey. The response to this question is to be filled by the counselor visiting the household based on members' recollection. For the patients who have taken the TB preventive treatment or are currently on TPT medication, the status during exit will be patient currently enrolled in the TPT program. On the other hand, for the patients who were previously on TPT medication, the status during exit will be patient was previously enrolled in the TPT program. When the counselor reaches the exit survey section, Three fields are provided. The first field is to enter the GPS coordinate of the household. The next field is for the counselor or household members to provide any comment. The third field is for the status of the household member. The next section is titled Household Member TB Screening. The counselor goes to this section when the member has not taken the TB preventive treatment before. This section carries out a preliminary TB screening of the household member. The first question in this section is, have you ever taken TB treatment before? If the response is no, then the next question is, are you currently on TB treatment or diagnosed as a TB patient in Nikshay? If the response is yes, then the next question is, do you have a Nikshay ID? However, if for the question, are you currently on TB treatment or diagnosed as a TB patient in Nikshay? If the response is no, then the counselor will go to the next section, which is household member comorbidity and TB symptoms. If the response is yes, then the question asks whether the member has a Nikshay ID. If the member has a Nikshay ID, then the next question asks them to provide their Nikshay ID. If the member does not have a Nikshay ID, then the next question from the next section, that is household member comorbidity and TB symptoms, are asked. The next section is titled Household Member Comorbidity and TB Symptoms. This section captures the comorbidities of the household member. Here, only their HIV status is captured before exiting the survey, that is, what is your HIV test result? The options here are positive, negative, and unknown. For those patients who have entered their Nikshay ID, the status will be retreatment, new TB patient, notified in Nikshay. For those who do not have a Nikshay ID, the status will be retreatment or new TB patient without a Nikshay ID. The next question is only asked to those members who have selected no for, are you currently on TB treatment or diagnosed as a TB patient in Nikshay? The question is, do you currently consume or have any of the following? The options here are alcohol, tobacco, none, and others. For this question, select the ones that apply. If a member selects others, then in the next question, they have to specify the product. The next question is, do you have any of the following underlying medical conditions? The options here are silicosis, anti-TNF treatment, dialysis, transplantation, diabetes, hypertension, none, and others. If a member selects others, then they have to specify the name of the disease or condition in the next question that asks, please specify others. The next question asks if you are currently suffering from any of the TB symptoms. If no is selected and the age of the member is less than 5, which is captured in section B, then the questionnaire shifts to the section titled Household Member TPT Initiation. If the response is no and the age of the member is more than or equal to 5, then the next question will be, what is the status of IGRA testing? This will again only be applicable for districts where IGRA is available. Other districts can mark IGRA unavailable. Additionally, if IGRA results are negative, then for such contacts, X-ray also has to be done. If the response is yes, then the next question will be, which of the following symptoms are you suffering from? The options here are current cough, fever, weight loss for age greater than 6, no weight gain for the child aged 6 or below, night sweats, blood in sputum, and others. The next section, only applicable to those who selected yes to TB symptoms, is titled Household Member TB Test. The first question here is, have you done any TB test? There are two options here. If no is selected, then the counselor can exit the survey. The exit status for members who select no will be TB symptomatic patient to be referred. If yes is selected, then a few TB testing roster questions will be asked related to the test result. A roster is nothing but a set of questions getting asked again and again. In this case, it will be tests carried out to detect TB. This feature has been added because in certain scenarios, HH contacts suffering from TB symptoms might have done multiple tests to either confirm or rule out TB. The first question in the roster is about the type of test. The options here are chest X-ray, CB-NAT, AFB, smear microscopy, TrueNAT, and others. If chest X-ray is selected, then the next question is, what is the chest X-ray outcome? If CB-NAT is selected, then the next question is, what is the CB-NAT test outcome? If AFB is selected, then the next question is, what is the AFB smear microscopy test outcome? If TrueNAT is selected, then the next question is, what is the TrueNAT test outcome? If others is selected, then the next question is, please specify others and then you have to add the test outcome. Once the test outcome has been added, you have to respond to the following questions. Date on which test was conducted, who helped you in getting the test done, kindly mention the X-ray voucher ID or the CB-NAT NICSHE ID or any other ID. The TB roster questions end here. The next question is a roster check. The question is, has the household member listed chest X-ray as one of the tests done? If the response is no, then kindly get a prescription from MO and get an X-ray done. Getting an X-ray done is mandatory. The result of X-ray needs to be added in the roster and then move forward. If the response is yes, then the next question appears. The next question is, what is the final interpretation of tests on the status of active TB? If the response is positive, then exit the survey. If the response is negative or inconclusive, then the next question appears. In case the survey is to be exit, the status of member will be diagnosed as TB patient, pending notification. The next question is, what is the status of IGRA testing? Again, please note that this test is applicable for those where IGRA facility is available or pilot districts. If the response is myco-TB BASI confirmed or IGRA unavailable, then the next question is about the status of X-ray screening. If the response is myco-TB BASI not detected, then exit the survey. If the survey is to be exit, then the status of the patient will be TB symptomatic, IGRA negative if the member is currently suffering from any TB symptoms. The status of the patient will be TB asymptomatic, IgRA negative, no action required if the member is not suffering from any TB symptoms. The next question is, what is the status of X-ray screening? There are three options here: no TB, X-ray unavailable, and TB suggestive. If the response is no TB or X-ray unavailable, then the questionnaire will shift to the next section. If the response is TB suggestive, then go to the exit survey section. Upon exit, the status of the member will be TB suggestive patient to be referred. This completes the first part of the video on Household Investigation Questionnaire.